And while we continue to hear updates on the COVID vaccine, there's also more research on treatment if you get the virus.
And our Barrett Leone is learning more about possible treatment options. Barrett, what did you find out?
Well, Zach, Caitlin, I heard from a Mayo Clinic infectious disease expert who says there are a few treatments, but no one treatment for COVID-19 that fits everybody. So each patient is evaluated and treated in a case-by-case basis.
COVID remains a big problem.
A big problem that infectious disease experts continue to study.
If the virus cannot spread, it cannot mutate.
And as the country continues to fight off COVID variants, most prominently the Delta, therapies evolve too.
Depending on the clinical condition of a patient and their risk factors, they may be eligible for treatment with monoclonal antibodies, or for patients who require hospitalization, we have antiviral therapy in the form of remdesivir, as well as drugs that modulate the immune system or reduce inflammation in the form of steroids.
Both monoclonal antibodies and remdesivir have proven to be responsive to the Delta variant. Monoclonal antibodies are only available to eligible patients 12 and older with underlying conditions such as asthma, being overweight, heart disease, and more.
The eligibility criteria for many of these treatments, including monoclonal antibody therapy, is very wide.
As for children younger than 12, remdesivir can be used for treatment.
But the best really is prevention, so that people don't need to go to the hospitals to get these treatments.
Treatments aside, doctors amplify the most effective way to avoid hospitalization or death to the virus is prevention.
Vaccination, prevention is still the best. If you don't allow the virus to circulate because the majority of the population is vaccinated, then that will be the best effort, stop this pandemic.
We're told that while there are no treatments being developed specifically to treat the Delta variant, there are several new COVID treatments and therapies that are currently in clinical trials. Caitlin.